Yes, yes, we can start. We can start.
Chaitri, you can start.
Om Shri Dhanvantaraye Namaha, Om Shri Gurudevaha. Jignasa is a pan-India movement dedicated to creating unified platform for addressing all dimensions of the Ayurvedic systems, Ayurveda, Yoga, Unani, Siddha, Savaripa, and Homeopathy. With motto, learn Ayush to practice Ayush. Jignasa Karnataka stands as a pioneering organization among Ayush students ideas and impactful programs. We have successfully organized landmark events such as International Conference 2022, Yantra 2023, and Mattanam 2024 in collaboration with Nimhans for the homeopathic fraternity. Unnati 2024 was a unique platform dedicated to empowering homeopathy students. We have actively partnered with the government of Karnataka in Yoga Day celebrations, and our flagship event, Achintya Ayurveda, has emerged as a leading conference in field of Ayurveda across the state. To promote traditional cow-based health practices, we have consistently conducted Panchagavya workshops, training students and practitioners in the preparation and benefits of cow-derived products. Reaching out to underserved and rural areas has been a priority. We have conducted numerous health camps, awareness programs, and Swarnabindu Prashna drives aimed at improving children's immunity. In addition to support Ayush students during their academic journey, Jignasa Karnataka has continuously organized online classes, exam preparatory sessions, and career and postgraduate guidance programs, fostering clarity and confidence among graduates aspiring for higher education and professional excellence in the Ayush domain. In the ancient India tradition, knowledge was not merely taught, it was transformed into wisdom through deep mentorship and real world application. Young seekers would approach sages with one burning desire to learn, grow, and excel in their chosen path. Those timeless gurukuls didn't just prepare students for exams, they prepared them for life. Yashasvi Bhava draws inspiration from this sacred tradition, designed especially for fourth year BHMS and BAMS students. It serves as your modern day Gurukul focused and exam oriented initiative that helps you to conquer every subject with confidence and clarity. With daily NCSM aligned classes, expert faculty guidance, dedicated doubt solving sessions, and rigorous model paper practice. Yashasvi Bhav ensures you are not just studying, you are mastering. Join us in this on this transformative path where you'll not only prepare and perform, but truly prosper. Let the journey begin. It is with great pleasure that I introduce to you today's guest speaker, Dr. Harshita KS, an inspiring figure in the field of Ayurveda and role model for every aspiring Ayurvedic student. Dr. Harshita is an assistant professor in the Department of Kaya Chikitsa at Sri Kala Bhairaveshwara Ayurveda Medical College in Bengaluru. She holds an MD in Kaya Chikitsa from the renowned National Institute of Ayurveda, Jaipur, and is currently pursuing her PhD in the same field at Government Ayurveda Medical College, Mysuru. What makes Dr. Harshita's journey remarkable is her dedication not just to clinical excellence but also to research and teaching. She has worked on government sponsored projects at NIMHANS and CCRAS, focusing on clinical trials and diagnostic validation in Ayurveda. Her dissertation and research focuses deeply on the management of Amavata, and she has also presented and published several papers on chronic conditions like IBS, spondylolisthesis, and psoriasis. She is a gold medalist ranked first in her MD exams and a recipient of multiple awards, including Jivaka Award by Himalaya Pharma. Today, she is here to share her knowledge, experiences, and insights with all of us. Please join me in warmly welcoming Dr. Harshita KS to the session. I welcome you, ma'am. Now, I would like you to continue the session, ma'am.
Ma'am, you can start the session, ma'am.
Ma'am, the session is yours, ma'am.
Am I audible?
Yes, ma'am, you're audible, ma'am.
Yeah. Okay. Thank you for the introduction, and we'll start the today's session. Give me a moment. I'll share my screen. I hope the PPT is visible. Uh, Hello everyone. I'm Dr. Harshita Case. Today I'm here to brush up all the topics which have been studying for Kaya Chikitsa and tell you how to approach Kaya Chikitsa exam, the final year Kaya Chikitsa exam. Especially today we'll be covering the paper 1 of KC. So before going to all the question papers and how should we approach all these question papers, what are the must do's in Kaya Chikitsa? So in Kaya Chikitsa, there are four important points before you go to the Kaya Chikitsa exam that you have to know and you have to be well versed to make sure your papers go right. So first one is Nidana Panchaka. So there should be no doubt before you enter the hall for Kaya Chikitsa examination whether you should know Nidana or whether you should know Lakshana or whether you should know Samprapti, because Kaya Chikitsa deals with only Kaya Chikitsa. That should not be the scenario, because you've already studied Roga Nidana and then you have also studied Charaka Samhita and then you have come to the final year for Kaya Chikitsa. So the Nidana Panchaka as a whole, at least for all those chapters which are mentioned in Charaka Chikitsa Sthana, it is a must do. You should be knowing what are the specific nidanas, what is the Vishesha Samprapti, of these diseases. That is a must do. The second one is, as it is Kaya Chikitsa, importance should be given to Shamana Aushadhis. So you cannot start your answers writing okay Sarvanga Abhyanga with Bhashvasveda, or you cannot start any answer writing okay Kati Basti or Griva Basti. No doubt those are excellent treatments. They do work and patients do come for a panchakarma for us, but more importance should be given to Shamana Aushadhis when you're writing the Kaya Chikitsa paper. It can be the Kashaya yogas, or it can be the Churna yogas, it can be the Arishta yogas, or it can be the Ghrita yogas, Vati Kalpanas, Rasa Aushadhis, Parpati Kalpanas. So there are n number of Aushadhi Kalpanas, Kshira Kalpanas, Paniya Kalpana, Yavagu, all of this should be given importance. If there is a disease which is been given, then you have to make sure that under all these categories you are mentioning Shamana Aushadhis. So for all the main diseases which come both in paper 1 and paper 2, knowing the Shamana Aushadhis, minimum 4 to 5 Shamana Aushadhis for each disease. So you cannot write Chitrakadivati, Agnitundivati for all diseases. That cannot be done. So if Parpati Kalpanas are there, then you are writing in Grahani. Rasa Parpati is there, Panchamrita Parpati is there. So Kasa Shwasa is there. Then you are going and writing Pushkarasava, all of those. So those disease specific Aushadha yogas you should be well versed, so that you'll be writing in the paper. You cannot think on the day of exam, okay, what was written for this patient. So you should be well versed well in advance the Shamana Aushadhi yogas for all the diseases. That is a must do. The third one is question papers, just to be aware of the format in which the questions are being asked, what is the weightage for each topic, and just to be well prepared. For example, if this disease comes for 5 marks, what should be able to do? So those are the things which you have to pre-plan, not on the day of the examination. Those things you have to pre-plan. For example, if Amavata comes for the 10 marks, what all the things should I cover? If it comes for 5 marks, what all should I cover? So what are the possibilities in Amavata that short answer questions of 3 marks can come? Okay, so that's why you have to revise the question papers well in advance, just to know how the questions are being asked and what is the topic specific questions which are being asked. The fourth and very important one is the time management. So you have long essay and short answer questions. So how should you manage the time? Many of the cases, what happens, there are some questions which you are very well versed, you know all the sutras, you know the treatment plan, you know the avasthanusara chikitsa, you get excited and you start writing and you lose time. So time management, so how many minutes are you answering 10 mark question, 10 mark question? How many minutes are you taking to answer the 10 5 mark questions? And how many minutes are you taking to answer the 10 3 mark questions? It has to be well demarcated, and then you have to enter the examination hall. For example, if you're keeping 1 hour for or 2 10 mark question, half an hour for each, 1 hour for all the 5 mark 10 mark question, and 1 hour. So you have to divide based on that, and then make sure you're attending the question so that you will not lose the count of time in attending all the well versed questions. So I told you what are the must do's when it comes to Kaya Chikitsa. Now, what are the non-negotiables? Non-negotiables is there is no way that these should be missed in your papers. There is no way that this should be missed while studying Kaya Chikitsa, or there is no way that without understanding this, you are giving Kaya Chikitsa exam. So these are the non-negotiables. First one is the disease introduction, the nidana, and the samprapti, which again comes under Nidana Panchaka, but more importance given to the Nirukti, the Nidana, and Samprapti. Okay, then is the Chikitsa Sutra. So Chikitsa Sutra comes under a non-negotiable point. You cannot tell that it is difficult for me to learn the shloka, so I have not learned this, or I'll not be writing this Chikitsa Sutra. That is not entertained at all, because just in a 3 marks question there will be direct question to write Chikitsa Sutra, or in the 5 mark they can ask any avasthanusara chikitsa sutra. So chikitsa sutras of all the disease is a non-negotiable. You have to learn the chikitsa sutra, then only you can expand the answer based on the marks. So chikitsa sutra is a non-negotiable. The third is key points and concepts specific to each disease. So there are some concepts which you have to understand which are very much specific to the disease. For example, langhana when it comes to jwara. So what are the indications of langhana, in whom you should not do the langhana, and what all yogas you will do langhana. So that is a non-negotiable when it comes to jwara. Ghrita prayoga in jirna jwara, kshira prayoga in vata pitta pradhana jwara. So all of these are specific to jwara, or it can be for partikalpana of grahani, takra prayoga in grahani, or it can be basti, kshira basti when it comes to vata rakta. Okay, or it can be siraveda when it comes to visarpa, or it can be bahusho shodhana when it comes to kushta. So all of these are the concepts which are very much specific to the disease. So you learn certain part of chikitsa sutra, and also along with that there will be certain chikitsas which you have to explain even though you don't know the proper sutra. So those will be the key concepts. So you should also include those key concepts when you're writing the answer. The last one is chikitsa yogas and your ideal prescription. So as you are learning the kaya chikitsa, you make sure you are giving importance to the chikitsa yogas, as I told you, the disease specific the yogas, and also the your ideal prescription. So you have learned this many year, 1.5 year of Kaya Chikitsa. So you have been posted in Kaya Chikitsa OPDs, you have taken so many Kaya Chikitsa cases in IPD. So you should be able to form your own ideal prescription. So it can be a long essay question, long answer question. So they might have asked only one disease, the Nidana Panchaka and the management of that disease. By writing your own ideal prescription, that fetches you more marks. That ensures the examiner that okay, this person or this student has studied theoretically also, and even practical exposure was there, and now he's in a state where he can write your own ideal prescription. Okay, so these are the non-negotiables. The disease introduction, that is nirukti, nidana, and samprapti. You can either write samprapti in the form of sutra, or it can be a chart. Chikitsa sutra, one Chikitsa sutra or 2 to 3 Chikitsa sutras, but minimum one in all the main diseases. Key points and specific concepts of each disease, Chikitsa yogas, and ideal prescription. So now when we see the question paper, you have three main categories of question. One is short answer, which comes for 3 marks. Then you have short essay questions, which come for 5 marks. And you have long essay, which comes for 10 marks. So short answers, usually the questions will be targeting on what is the definition of this disease, or what is the definition of this particular disease state, or what is one specific national program which is targeting this particular disease. So it is very specific. Or it can be the types of disease. So what are the types of disease XYZ? What are the types of Amavata, or what can be the types of Jwara? Okay, and specific treatment. It can be Grita in Jirna Jwara, or it can be Pratiroga, or in Raktapitta, it can be any specific yugas for Nasagata Raktapitta. Okay, and it can be just like a simple direct questions where they ask for Shamana yogas for this particular disease. So these are the types of questions which are being asked for short answer questions. Then comes short essay. So in short essay, mainly the avasthanusara chikitsas will be asked. For example, you have Mrit Prakshana Janya Pandu. So what is the chikitsa of Mrit Prakshana Janya Pandu? Because you have one only specific amount of content which you can write. You cannot start from Pandu and then land up in Mrit Prakshana Janya Pandu for short essay. You have to make sure you're writing the right answer and right chikitsa which is given in Mrit Prakshana Janya Pandu. Or it can be the Basti Prayoga in Amavata. Very, very specific, yet you have lot of matter to write. That will be the short essay. In the long essay, the Nidana Panchaka, which includes the Nirukti, which includes the Nidana, which includes the Lakshana, the Samprapti, Chikitsa Sutra, or it can also be a merge of so many sub questions. What is Chikitsa? What are the tools which you use to examine in Roga Rogi Pariksha? And then your ideal prescription of any other disease. Or it can be Shita Pitta Udarda Kota, all those small diseases clubbed into one, all the sub questions clubbed into one long question. So all of this can happen. So these are the types of questions, and this is their areas in which they are picked up. So if you're studying a disease, make sure you study it completely, so that you know the types, you know the Shamana yogas, you know the specific treatment for short answer questions, you know the Avasthanusara Chikitsa for short essay question, and a disease as a whole for a long essay question. That is how you will be prepared for writing all these question answers. So now what should I write for long answer question? So what all should be included? So there should be introduction, there should be samprapti of that disease. I'm telling for long answer question. There should be chikitsa sutra, chikitsa avasthanusara chikitsas, and the yogas which are given in that chikitsa, and your ideal prescription. So you will start with the introduction. Introduction should not be very long. You have to finish within 1 to 2 lines. So preferably write the nirukti so that it is very pinpoint specific to the disease. Then the samprapti of the disease. So as it is a long essay question, so make sure you write the chart of the samprapti and point out the important timelines in the samprapti, what is happening. Then the chikitsa sutra and the avasthanusara chikitsa, and then the yogas, what yogas are you giving? 3-4 minimum Shamana Aushadha yoga, or if you want to categorize, one Kashaya yoga, one Churna yoga, one Vati yoga, and at last your ideal prescription. So if the patient of Amavata comes, so what is your ideal prescription? Are you going with Rasa Saptaka Kashaya, Simhanada Gugulu Gandharva Hasadi Kashaya, something like that, with dose and with the time of medicine and with anupana. That forms a complete prescription. So this is how you approach a long answer question. This is how you should mentally prepare with terms of marks. It is not like you're writing page togethers of samprati and there is only one paragraph of chikitsa. That is not done. Or you're writing page together of chikitsas and there is no samprapti at all, because samprapti vigatana itself is chikitsa, right? So all of these points, make sure this is how you mentally prepare and approach that long answer question. Even though this will not be told, okay,
Excuse
right?
me, ma'am.
Yes,
Ma'am, your slides are not
yes.
changing, ma'am. Ma'am, slides are not changing.
Which slide are you able to see now?
Ma'am, the first slide
Now are you able
itself,
to
ma'am.
see?
No, ma'am.
But I'm changing all those slides. You are
Ma'am,
able
but
to
it is
see?
not. No, ma'am.
Oh God.
Ma'am,
Why
can
is
you
this?
give just, ma'am, 1 second. Can you give slideshow?
Yeah, I'm giving slideshow itself.
But we are not able to see that, ma'am.
Even now you are not able to see. That's why I asked, right? Are you able to see the slides? None of you replied.
Ma'am, now it is changing. Yes, ma'am.
Now, are you
Yes,
able to see
ma'am.
the second slide?
Yes, ma'am. Second slide, ma'am.
Okay, so this must do in Kaya Chikitsa. I think all of you have heard. Can anyone tell me, are the slides moving now?
Ma'am, it is still a second slide, ma'am.
Now
No, ma'am.
I have put to third slide.
Yes, ma'am. Now. Yes, ma'am. Now it got changed, ma'am.
Are you able to see the non-negotiable slide?
Yes, ma'am.
Yes, so this is what I was telling for the long answer question. So this is how you should mentally break down the marks. So even though this will not be specified in the question paper, no one will tell you that you write this much marks for samprapti, this much chikitsa for this much marks. This is how you should break down and write. For introduction nirukti, it should be very point specific. Write it for the introduction. Keep 3 marks, that much of matter, or 2 to 3 marks for samprapti, 4 to 5 marks for chikitsa, avasthanusara chikitsa, yogas, and your ideal prescription. So for all the long answer question, make sure you add that one important point of you're adding your ideal prescription. That instantly captures the eyes of the examiner. Okay, and your ideal prescription should be perfect. You should write how many doses the patient should be able to, will be able taking the medicine, what is anupana, aushadha sevaniya kala, all of this has to be written. Then only it will be an ideal prescription. You cannot just name the medicines. If you are naming the medicines, that will come under chikitsa yogas. Okay, yes. Next, for the short essay questions. So make sure you are very point specific, because even the questions will be very specific. It can be the national program, national health program for tuberculosis. So you cannot bluff so many things about, or you cannot start writing about the pathogenesis of tuberculosis or the types of tuberculosis. No. So the question is very, very specific. What are the national health programs for tuberculosis? So you write at what year it was introduced. Then there were many revisions which happened to the national tuberculosis protocols for multi-stage sampling, multi-stage diagnosis. So all of this will come under this specific point. So if they're asking the chikitsa of any specific disease, so make sure, for example, if Amavata itself is asked in long essay question, then give less weightage to the samprapti, more weightage to the chikitsa. So write Langhanam Svedhanam Karo, that particular chikitsa sutra, and explain each one of it. Langhana, Svedana, Kala, all of this you have to explain. And then you have to write. Okay, then Avasthanusara Chikitsa, they may ask Mrutbhakshana Janya Pandu, or they can ask the Sannipata Grahani Chikitsa, or it can be Vyathyasa Chikitsa in the Grahani, or it can be Jwara, Dhatugata Jwara Chikitsa. So that also should be very specific. So you give some small introduction or a chart of Samprapti, where again don't waste so much of time in writing the Samprapti, but more of Chikitsa should be added. So this is about the short essay question. Next is short answer question. So short answer question should be very quick in answering, and also they should be very point specific and nothing extra. If you're writing something extra, you're losing time. You'll not be able to attend all the other questions. So you'll be very specific. If they're asking 4 Shamanaushadha yogas, 4 to 5. If they're asking what are the national health programs of non-communicable disease, only non-communicable disease. If national health programs of communicable disease, then national health programs of communicable disease. So there is no introduction when it comes to short answer question. There is no anything extra to be written just because you know something extra of that disease. No, it is very direct question. Don't waste much time in short answer question. It should be very point specific. So now we shall take a look of the question papers. I think in slideshow you're not able to see the slides. I'll just put once more slideshow. If it is visible, please tell me. If not, in this mode only I'll be presenting. Are you able to see the slide now?
Yes, ma'am. We are able to see the slide, ma'am.
Okay, you're able to see this table.
Yes, ma'am.
It is moving right now.
No, ma'am. It is not moving. It is constant. The same slide, ma'am.
Okay. Yes. So I'm taking the question paper of March 2025. So we'll break down the question paper. For 10 marks, Aushadha Sevana Kala was asked. And the second question was Vishama Jwara Chikitsa. So you can see here one Chikitsa Siddhanta they have asked. So that is from part A, and from part B they have asked the disease. I want all of you to hold the syllabus copy. So hold paper 1 part of Kaya Chikitsa, so that it will be easy for you to trace whatever I'm telling you. So in paper 1 you have part A and part B. So in part A it is most of the concept based topics which are given, and in part B you have all the disease specific questions. So whenever they ask in most of the questions, not all question papers, in most of the question papers, amongst these two questions of 10 marks, one will be based on the Chikitsa Siddhanta and one will be a direct disease. For example, you can see in the same question paper, you have one question for Aushadha Sevana Kala, which is a Siddhanta based question. And the second question is the applied level, the direct disease question. Okay. So then in the 5 mark questions, there is naturopathy system of medicine. So all of this systems of medicine, it will come in part, it will come in part B. Right. So amongst all this, it can be naturopathy, homeopathy, yoga, or it can be siddha. Right. So one system of medicine is repeating in all the question papers. At least one system of medicine is being asked. So that point you cannot neglect. So it is asked in each and every disease and of this particular system. So how yoga is approaching disease, how siddha system is approaching disease, how homeopathy is approaching disease, and when are their specific national days celebrated. Just like you have National Ayurveda Day, when is National Siddha Day, when is National Yoga Day. So all of this should be written in that. Okay. So and next is the emergency management of CCF, Chikitsa Sutra of Madatyaya, Samadosha Lakshanas, Raktadosha Vikara and management, Chikitsa Sutra and Chikitsa of Shvitra, Samprapti and Chikitsa of Richula, with respect to the angina pectoris, Sannipata Jwara Chikitsa, thyroid disorders and management. So Samadosha Lakshanas, again, we'll be seeing a couple of question papers. Samadosha Lakshanas and management, again, it is a very repetitive pattern of question. So the types of question in this particular point, they have asked the Nirama Vata Lakshana, alone for a long essay question. In many of the question papers, they have asked what is Samakapha Lakshana, what is Samapitta Lakshana, or what is the Chikitsa for Samakapha Avastha. So Samadosha Lakshanas, even though you feel it is not so important, but in question papers they have asked it very repeatedly. Of all the three doshas, Sama Avastha Lakshanas and Nirama Avastha Lakshanas, there are certain shlokas that is a must know. Then comes emergency management. So in emergency management, you have a couple of disorders. So that is also an important question which is being repeatedly asked. At least one emergency management of any of these diseases is being repeatedly asked. So point number 8 when it comes to part B is very, very important. So don't just memorize a common emergency protocol for all diseases. They have asked from point number 8, there are high chances that questions of 5 marks and 3 marks come. For example, in many of the question papers, they have asked define renal colic. In many of the question papers, they have asked the management of CCF. They have asked the management of status asthmaticus. Okay, so point number 8, it also comes under must know, and the high probability of short essay questions and short answer questions from part B, part of part 1 will belong to point number 8. Then comes the couple of diseases when it comes to part B. So paper 1 is a beautiful amalgamation of all the concepts and also important diseases. So all those diseases when it comes to part B, I think most of the students will be very confident in writing because you have that much important concepts in all this disease. It can be Amavata, or it can be Jwara, or it can be Rakta Pitta, or it can be Pandu, Kamala, Halimaka. So all of these diseases are like favorites to the students because they'll be easily well versed with the Chikitsa Sutra, and also they'll be knowing the Avasthanusara Chikitsa. So for example, here when it comes to the Kushta, they have taken Shvitra. So here you cannot start writing so many things about Shvitra. They have asked the Chikitsa Sutra and Chikitsa of Shvitra. So you will write the Chikitsa Sutra of Shvitra and you will explain what is the Chikitsa Sutra of Shvitra, and along with that you will write the Chikitsa Yogas in Shvitra and also the Avasthanusara Chikitsa and Chikitsa Yogas and your ideal prescription. Okay. So and when it comes to the Jwara, so Jwara is a very, very important topic because Jwara alone has the capability in where the short essay question will be asked, long essay question will be asked, and also the short answer will be asked. So long essay question, the question it can be Vishama Jwara as shown in this question paper, or it can be Dhatugata Jwara, or it can be just Chikitsa Sutra and Chikitsa of Jwara, or you have given so many modern correlations of Jwara. It can be influenza or it can be meningitis, where all of these diseases are given. So they can club all those diseases and again give it for a long essay question. Okay, and the modern correlations of Jwara, which you can see in point number 1 of part B, it can be yellow fever or pleurisy or it can be meningitis. All of these diseases, also there is a high probability you get a short answer question of 3 marks in this. So high probability of Ayurveda concept of Jwara for short essay and long essay, and all the model correlations, you have the high probability in the section of short essay and short answer questions. So then comes the 3-mark question. So here again, as I told you, it can be any types of the disease, types of the national programs, or it can be Samyak Lakshanas of all the Shadupakramas. So Shadupakramas are also in your point number 4 of paper A. So point number 4 of paper A is a very, very important point. There is a probability of long essay question, short essay question from this point. So for now, in this particular question, you can see the Aushadha Sevana Kala, which has been taken up from point number 4. So in the topics in point number 4, like Dividopakrama, or it can be Shadupakrama, or it can be Aushadha Sevana Kala. Even questions like Anupana and Pathya have been repeatedly asked for 3 marks. So point number 4 is very, very important for examinations because the long essay will be mostly picked up from this point. Okay, so this is about, and also one point which I want you to see is the Shudra Rogas. The Shudra Rogas come in the paper 1 itself. So in the Shudra Rogas, make sure you see the definition or chikitsa of each and every Shudra Rogas. So Shudra Rogas as such, in the previous question papers, it has been asked for short answer questions. So what is the chikitsa of Yava Prakya? Okay, such things like that. So there will be pinpoint lakshana to identify this disease and pinpoint chikitsa sutra. Okay, so for all the Kshudra rogas, don't worry that till now the long essay question have not been asked, but there is a probability more towards the short answer questions in which Kshudra rogas will be asked. So don't forget to read Kshudra yogas at least when you sit for a group discussion or you're bored with studying KC1, you want just take a break. At that time, take up Kshudra rogas and revise it very quickly, because we want a very specific answer when it comes to Shudra rogas. If you have not studied Shudra yogas, directly you will get 0 out of 3, because you'll be writing some random answer. Okay, and the same Shadupakramas, as you're preparing for long essay question, all the Samyak Lakshanas of that are important for the short answer questions. So here they have asked Samyak Langana Lakshanas. Similarly, they can ask the other Shadupakrama Samyak Lakshanas also. Okay, and the one important point which I want to tell you, one more, is the Ojo Vyapat, Ojo Kshaya, Ojo Visramsa. So this comes under point number 3. So this is a question which is being repeated almost every year. But in some question papers, they have asked for 5 marks. Define Ojo Vyapat, Ojo Visramsa, Ojo Chikitsa. And in some question papers, they have asked what is Ojo Kshaya in for 3 marks. So make sure to know the difference between all the 3 and also the Chikitsa of all the 3, because this is quite an important question. So next question paper we are taking off July 2024. So here also, as I told you, one question is Chikitsa Siddhanta based. Second question is the direct disease question. So Kamala, in the Raktavaha Srotas in part B, point number 3, they have picked up one disease, and Nirama Vata Chikitsa. So as I told you, the Samadosha Lakshanas are very, very important. So here Nirama Vata Chikitsa they have asked. So here no need to panic. You can write the Nidana. From the Nidana you can start. What is the Nidana for Nirama Avastha of Vata? What are the Lakshanas of what are the Lakshanas of Samavata? And what is the Nirama Vata Lakshana? And then you can start. Here you can also take the help of the Nirupastamba Vata Vyadhi. So Nirupastamba Vata Vyadhi is nothing but Nirama Vata Vyadhi, and that Chikitsa Sutra also you can write and explain. Okay, and as I told you, Oja Vyapat Chikitsa, again very, very important topic. Almost in all question papers there is a probability of asking this question. Again, Samadosha Lakshanas, as I told you, in each and every paper, they have been repeating at least one dosha of Samadosha Nirama Avastha. And the Manasa Roga. So, Manas not changing.
Yes, ma'am.
But are you able to see the questions? Are you able to see now?
Yes, ma'am. Now it's changed.
Okay. So now, in the short essay question, you can see the Samana Chikitsa Siddhanta of Manasa Roga. So the point number, the Manas point when it comes to part A, paper 1, that is also important. So point number 5. So the probability of short essay questions and short answer question. So they have asked, clubbed all the Manasthana, the Manas Guna, Karma for a short essay question. For short answer, just the what is the Chikitsa Siddhanta of Manasika Rogas, or what is the Sthana of Manas, such points have asked. So don't skip point number 4. Okay, and then there is Chikitsa Sutra of Madatya. Here there is no any shortcut. You have to directly write the Chikitsa Sutra of Madatya, then Chikitsa Sutra of Rakta Pitta they have asked. And as I told you, Avasthanusara Chikitsa. So Kamal has been asked for a long essay question. The Avastha of it, Kumbha Kamal, has been asked for 5 marks. And as I told you again, an emergency management. So each and every question paper, there will be one at least disease regarding the emergency management. So here pancreatitis. So there is always a confusion whether should I write Ayurvedic when they ask emergency management of the disease, should I end with the Ayurvedic management of a specific disease, or should I just write the modern management? It is always better to write both, but give more importance to the modern management of the acute conditions until and unless they have asked the question Ayurvedic management. Okay, so for Ayurvedic management, for example, here pancreatitis, you can take the help of Udara Shula, Parinama Shula, Annadrava Shula, and then write those Chikitsa Sutras and write the Shamana Yogas, and then write, if you the prescription, that will help in the Ayurvedic management. So because they have pinpointly asked the management in Ayurveda, but until and unless they have used the word Ayurveda, if it is just the emergency management of CCF or emergency management of renal colic, more weightage should be given to the modern management, and then you can write the Ayurvedic management and finish it off the answer. Okay. And next, when it comes to the 3 marks, so you have 1 point in paper 1, the endocrine disorders. So in which come from for the short answer. So this is point number 6 in part B of paper 1. So thyroid, parathyroid, pituitary, pancreas, and adrenal glands and their management. So this in this these are the questions. So parathyroid context, or it can be as there is pancreas, you should also be knowing about diabetes mellitus when it comes to the paper 1. So read about the diabetes mellitus. I'm not telling you to read about prameha, but diabetes mellitus, because it comes under the endocrine disorders. And then again, see here, for the emergency management, they have given asked the status asthmaticus. So don't skip it for both short answer and short answer. As I told you, that topic is more prone for short answer and short essay question. And then you have all the small diseases. It can be murcha, sannyasa, again, which comes under raktavaha. You should be prepared for the short answer question. Okay. Next. So this is July 2024 paper. I hope it is visible. Has the slides changed?
Yes, ma'am.
Yes. So now July 2024 question. Again, as I told you, Chikitsa Siddhanta Shadvidopakrama has come, and one disease. Okay, from part A and part B, but this is not the chance in all the question papers. So this is the standard format, but that doesn't mean that both disease they can ask or both Chikitsa Siddhanta can be. In some question papers, they have indeed asked. So here in Shadvidopakrama, you may ask me, ma'am, what should we write? Because there is so much to write. So how do I condense that in 10 marks? So Shadvidopakrama as such, if you see the Charaka Sutra, in Shadvidopakrama, what all comes? The definition of each and every Shadvidopakrama, and then the gunas of the dravyas which are selecting for Shadvidopakrama. For example, let us take Langhana now. So Langhana definition will come. What are the dravyas which you should use for Langhana? So that dravya gunas will come. And then what are the indications of Langhana will come. Samyak Langhana Lakshana will come. Okay. So these 4 points will be for all the 6 upakramas. So now when it comes to Shadvidopakrama, again a high probability of asking Shadvidopakrama for a long essay question, because you have a lot of things to write. So here you should take the help of all the charts to write this answer. So if you know the shlokas, again put it in a chart. And if you're not good with the shlokas, at least Sanskrit terms you have to write when it comes to the indication, all of that. So if you're first attempting the short this long answer question, so make sure you're saving time, because if you start with Shadvidopakrama, there is a high chance that you will lose time, because there is so many things to write. So make sure you put a chart. So first write what are Shadvidopakramas, write their definition. If you know the shloka, good. If not, define them. What does Langana do? It imparts Laghuta in the Sharira. Okay. So write the definition. Take one upakrama by one upakrama. Start with Langhana and then end with Stambhana. Right. So first start with Langhana. So write what is the definition. You write the definition, the Langhana definition. Indications, write the indication. Samya Guna, and you should also write the mode of action. So how is Langhana working? And then give example of 2-3 diseases. For example, Langhana comes in Jwara and also in Amavata. Right? Then that's how you should write the Langhana. Then go for Brahmana. Similarly, go for Snehana, Rukshana, Stambhana. So that will be an ideal answer. So in such case, if you write in this format, you have touched all the angles when it comes to Shadvidopakrama. So practical applicability you have also written, telling that in this particular disease, in this avastha, you are writing the Shadvidopakrama. The concept based part also you have touched, telling that this is a definition, these are the gunas, and this is the samyak lakshanas. So it will be both the applied and basic concept of this particular question. It will be a final year level answer. Okay. Then comes the Amavata. All of you will definitely be knowing the Chikitsa Sutra of Amavata. All of you will definitely be knowing the each and every Upakrama when it comes to the Chikitsa of Amavata. So that is a very important question. So that is a non-negotiable. So right, so you have to write the Nidana of the Amavata, the Samprapti, then the Bheda. If you, when you have Pravridama Vatavastha, then what are the some specific lakshanas for both of it, and then write the Chikitsa Sutra, and then explain it, write the Shamana Yogas, and then end it with your ideal prescription. Okay. Now, if we are seeing the 5-mark question, as I told you, don't skip diabetes mellitus when it comes to the endocrine disorder. See, you have Patya Patya in diabetes patient. So this is a question for 5 marks. So just remember, so Patya Patya, I'm telling you with specific to this point. Again, Patya Patya has been asked in many question papers repeatedly, and they have also taken the diseases which are of paper 1. Like Patya Patya in Jwara. So Jwara comes in paper 1 itself. Patya Patya in Rakta Pitta. Again, Rakta Pitta comes in paper 1 itself. So for all the diseases which are there in paper 1, make sure to learn their Patya Patya. So when Patya Patya is given, so write the importance of Patya in a disease, and then what are the specific Patya you will be giving in that particular disease, and then end your answer with a conclusion. How does it help? Or for example, if you take Yava Pradhana Bhojana in Madhumeha. So Yava can be lower glycemic index, it is high in fiber, it is hypoglycemic. So all of these points you can write in the conclusion and then write the answer. And along with it, Yava, all the other patyas, you have to soak some grains in the gomutra and then use. So all of this will come under patya. So don't just focus on the patya, also write the apatya of the disease. Okay, right? Both patya, apatya. And one more tip which I want you to give here is make sure to write patya ahara, apatya ahara, patya vihara, apatya vihara. Then you will also have so many headings to write, and also your answer will seem lengthy. Okay, so for all the diseases which have been given in paper 1, make sure you will learn the patya ahara vihara, apatya ahara vihara. Okay, and yes, next one. So as I told you again, thyrotoxicosis when it comes to the endocrine gland. So don't skip that point. They have given thyroid gland thyrotoxicosis. And also as I told you, the modern management of the fever. So dengue fever and its management for short essay question. So that fever point is very, very important. Muscular dystrophy and treatment. Then, as I told you, Manoguna and Manokarma, the point of Manas for short answer. Then Beriberi, which comes under nutritional deficiency, Jivha Pariksha and Panduroga and Kamala. So this is an applied question. This is a very good question because you have Ashtasthana Pariksha when it comes to the paper 1 part A. In part B you have diseases, so they have combined it. So how do you do the Jivha Pariksha when it comes to Panduroga and Kamala? So here write what are the lakshanas which are given with specific to the Jivha, and then you can write the answer. So Vyathyasa Chikitsa they have given. So Vyathyasa Chikitsa you have in Grahani, you have in Kasa, you have in Vatavyadi. So what do you mean by Vyathyasa? So you give the example of these diseases. And Vyathyasa of what? Whether it is Ushna Snigdha Guna or whether it is Rukshana Brumhana. That if you give the examples, it will be a complete answer. Then antihypertensive drugs, again as I told you, the emergency management, it comes under that. Okay, Purana Jwara, as I told you, yes, Avasthanusara Chikitsa, short answer, short essay will come. So this is Purana Jwara. Padadari, again, as I told you, which will come under Kshudra Rogas. So here, if you don't read Padadari, straight away you will be losing all the 3 marks. So make sure you learn and read about Shudra Rogas. Prepare all the Shudra Rogas for 3 marks at least. Then Mursha Chikitsa, as I told you, all the small diseases which come under Raktavaha, Sanyasa, Murcha, all of this for 3 marks. And Kushta, Kitibha Kushta, they have asked. Yes, so this question paper, this is from August 2023. So Here, this is one exception of the question paper where both the questions are of diseases. So usually in all the question papers you had seen that one will be the concept based and one will be the disease. But here both are diseases. So they have asked Nidana Panchak of Pandu and also the Nidana Panchak of Visarpa and Chikitsa. So make sure you write the Nidana, Lakshana, Samprapti, Chikitsa Sutra of Pandu, Avasthanusara Chikitsa of Pandu, the yogas and your ideal prescription. The same applies to Visarpa. In Visarpa, here you should also write the types of Visarpa. Okay, and the dosha pradhanata. So, what is Kardama Visarpa? What is Granthi Visarpa? What is the dosha pradhanata of each of it? Write the Chikitsa Sutra of Visarpa, and then you write that all the Avasthanusara Chikitsa, all of it. So, again, as I told you here, you are in a system of medicine. Any one system of medicine will definitely be asked. So, now Rutshula. So, all the management of Rutshula, even the modern management you can add here because they have given just Rutshula. Doshopakrama, again from part A they have asked. So here again you have to divide into Vataja, Pittaja, Kapaja, Upakrama and you have to write the specific points for each of it. Then importance of Roga Rogi Pariksha. So what is Roga Pariksha? What is Rogi Pariksha? Decipher into both of this and then you can add. Then it will be a beautiful answer. So in Roga Pariksha you do Ashtasthana, Dashavida Pariksha. When it comes to Rogi Pariksha, we will do the Nidana Panchaka, all of this. Roga Pariksha, Nidana Panchaka, Rogi Pariksha, Ashtavida, Dashavida. So all of this, if you decipher and write, it will be a good answer. Then all the definitions, again, as I told you, define Bheshaja, they have asked for 3 marks. Again, the Samadosha Lakshanas, it has been repeated in this question paper also. Sama and Niramavata Lakshana, they have asked. Java Prakya in the Kshudra Roga, Vyanga also in the Kshudra Roga. Leptospirosis, the point which comes under fever. So as I told you, one specific Avasthanusara Chikitsa will be asked. Importance here, they have asked. Importance of Basti in Vata Rakta. Again, fever, they have asked. Chikungunya, hyperglycemia, the emergency management, Kumbhakamala Avasthanusara Chikitsa, and the pancreatitis emergency management. So this is the question paper of July 2022. So here again, one is Chikitsa Siddhanta based and one they have asked the disease. So this is a question paper where more weightage was given to the emergency management of the disease. So one question they have asked with Upakrama. So one with one suitable example for each. So this I've already told you how to answer. So acute respiratory distress syndrome, ARDS. So what is the definition of it? When will do you diagnose it as acute respiratory distress syndrome? What are the investigation tools you will be using? What are the symptoms with which the patient will come? And then the management. As it is a long essay question, so we'll be taking from the definition, the signs and symptoms, the pathogenesis, the investigations, and then the management, and then the possible management through Ayurveda. So are you going to use Pottali Kalpanas? Are you going to use the Rasaushadis, the Bhasma Kalpanas? Or are you going to use any Nasya Kalpanas? All of this will come under the Ayurvedic management. So both you have to balance and make this answer. Okay. Then here, so in this question, most part of part A was asked. For example, Ashya Apakarsha was asked, Vimarga Gaman of Dosha was asked, which comes under Shatkriya Kala. So importance of Satmya. So all of these questions, make sure you give example. So Vimarga Gamana, you give an example. Ashya Apakarsha, give an example. So how do you give an example? By writing the Samprapti of that disease. If you write the Samprapti and Samprapti Ghataka of that disease, then it will be an ideal example. So write what is Vimarga Gamana, in which stage of Shatkriya Kala Vimarga Gamana will come, and give an example of the disease and write the Samprapti chart, Samprapti Ghataka, and highlight at which phase Vimarga Gamana was there in this disease. Okay, and then Ayurvedic and modern management of viral fever, again in the fever. So Shwitra, as I told you, 5 mark question. And so here amongst all the systems of medicines, yoga has been asked. The National Health Program, tuberculosis, but here they have asked the Ayurveda management. So go through the recent research papers, what have been the advancements in treating of tuberculosis in Ayurveda. There are papers where the adjuvant of Ayurveda Rasayanas, especially Ajamamsa Rasayana, was given with anti-tubercular drugs. So you can quote such things. Okay, and again here hypothyroidism, the endocrine point, again it has been told here. So here write what is hypothyroidism, what are the management of hypothyroidism, and in Ayurveda what is it is correlated to, and then how are you going to approach the disease, whether are you going to take it as Dhatvagnimandya or whether you are going to take it as Rasa Pradoshja Vikara. So now here it becomes an applied aspect because you have Pradoshja Vikaras in part A. So Rasa Pradushta Vikara, and then you have hypothyroidism. So you can apply both of it and then write the answer. So again here, Lina Dosha, Chamana Chikitsa, again types leptospirosis, Hridroga Chikitsa Sutra, Halimaka Chikitsa, leukemia. So all these are for 3 marks. Okay. So in many of the question papers, Shadvidopakrama has been repeatedly asked. You can see this question paper, this I have taken from July 2021. Again Shadvidopakrama, and here Jwara, and they have asked in specific Chikitsa Sutra and Chikitsa Vishama Jwara. So Shadvidopakrama, it is already taught. So now Jwara, so you have to write what is Jwara, the Pratyatma Lakshana of Jwara. Then start writing from Vishama Jwara. So Vishama Jwara, what are the 5 types? What are the some extra types which other acharyas considered as Vishama Jwara? Write the samprapti of each and every Vishama Jwara. What is the sthana? For Chaturthaka and Tritiyaka Jwara, you have types also, write the types. And then how do you approach Vishama Jwara Chikitsa? So you have to write the Chikitsa Sutras. And one important thing is the Kashaya Yoga for Vishama Jwara. Kalingaka Patolasya Patram Katukarohini. That particular Kashaya where each and every path of the Kashaya is for one Vishama Jwara. So that is a non-negotiable. That Chikitsa Sutra, along with that, this Kashaya Yoga also has to be written. If as it is along as the question, you can you can also write the types of fever. It can be intermittent, remittent, such fever, and then give an example. So malaria, you are correlating to what? Because it comes in this many days. Step ladder fever of typhoid, what are you going to compare? So you can give an example of that and then end an answer. So then coming to the 5-mark question, again, dosha prataneka chikitsa, lina dosha, emergency management of hyperglycemia, amavata chikitsa is there, and when it AIDS management, national health program, and also what Ayurveda inputs you can give. So for all the national programs, make sure some part of Ayurveda contribution you will remember. For it can be AIDS, or it can be tuberculosis, or it can be leprosy. So what Ayurveda can contribute in future for these health programs, such one addition will give an important or more weightage to your answer. So for all those diseases in which national programs are there, make sure you're also writing the Ayurvedic part for it. So here also for 3 marks, again there is Niramavata Lakshana. As I told you, Patya in Kamala. So Patya comes in part A, Kamala disease comes in part B. As I told you, for all the diseases in part B, learn the Patya. So here they have asked in Kamala. Yes. So this last question paper we will see. And then we'll go to the conclusion. So this is of February 2018. Okay. So here there was Samanya and Nanatmaja Vikara. Again, based on the Chikitsa Siddhanta. So here what should you able to, how should you approach this question? Samanja Vikara and Nanatmaja Vikara, write, if not the complete names of the disease, write how many Nanatmaja Vikaras are there, 80 for Vataja, and then amongst that name a few. Even if it is 4-6, it is fine. Name a few. And then in the same chapter, they have in detail given the Nanatmaja Vikara Chikitsa. What is Vataja Nanatmaja Vikara Chikitsa? Kaphaja, and then explain what is Samanaja. In Samanaja also, if not, you're able to name the types of all the diseases. At least take 3-4 diseases. and then give an example for it, and then write the difference between what is Nanatmaja Vikara and the Samanaja Vikara, and then you can give an example, and then you can end that answer. So now the second question, as I told you, all the small diseases can be picked up and made into a long essay question. So this is an example. So you have Sheta Pitta, Udarda, and Kota. As such, even Sheta Pitta, you don't have so many things to write for a 15 marks. Udarda and Kota, even that. But if you club all of these small topics, you can make it into a long essay question, right? Similarly, now here you have to write, explain each of it. Sheta Pitta, the Samprapti of Sheta Pitta, again, which is very short, the Chikitsa Sutra. Udarda, Samprapti, Chikitsa Sutra. Kota, Samprapti, Chikitsa Sutra. And what are the dosha pradhanata of each of this, and then write the Chikitsa yogas for each of this. Okay. And then here the Shadupakrama, see, Shamana has come, the Rukshana has come, and again, as I told you, Patya in Vatarakta. Vatarakta comes in part B. So Vatarakta Patya Patya they have asked. The complete point of Manas they have asked for 5 marks. Sleep disorders and their Ayurvedic interpretation. Doshava and Panduroga, and also they have asked the difference between Kumbha Kamala and Halimaka. So here you have to write the difference in the Lakshanas, the status systematicus they have asked, and Nahi Basti Samam Kinchit Vatarakta Chikitsitam. So this they have given. Here you have to explain the Chikitsa Sutra of Vatarakta and why Basti is important. So after explaining why Basti is important, you have to write some of the Basti yogas which have been advised in Vatarakta. So in the same 3-mark question, there is one emergency management, then one Chikitsa Avasthanusara of Shvitra, then one type of Jwara, one endocrine disorder. Okay, so now I will sum up what are the priority based topics which you have to read and know when it comes to. Point number 1, there is derivation of Kaya Chikitsa, the types. So here the most probability will be to ask a 3-mark question. It can be the synonyms of Kaya, it can be the synonyms of Chikitsa, it can be the definition of Bheshaja. And for the rest of the part, Chikitsa Chatushpada, Rogi Rogi Pariksha Siddhanta. So there is a probability of asking a short essay question. So there is 2 marks and 3 marks weightage from point number 1. Point number 2 is a very, very important question. So Kriya Kala can be as such asked for a long essay question, and they can pick up one Kriya Kala and they can ask for a short essay question. Point number 3, so most of the question papers from this point itself will ask a long essay question, but that point is important. Doshapakrama is important, Lino dosha is important, Dhatu Pradoshta Vikara is important, Samanatya Nanatmaja Vikaras are important. So point number 3, high probability of asking long essay and short essay question. In point number 4, again for short essay question and the short answer question. So each and every upakrama they can ask for 3 marks or it can be 5 marks. Point number 5, so Manas for 5 marks and 3 marks, and then you have nutritional deficiency disorders for 3 marks. Then 7th point, so 5 marks and 3 marks. But Alzheimer's disease has been asked for long essay question very, very repeatedly. So I've not covered all the question papers, but in most of the question papers, Alzheimer's disease has been asked. So don't forget to read Alzheimer's disease. And point number 8, the probability of 5 marks and 3 marks. The points like drug allergy, the genetic diseases, environmental diseases, iatrogenic diseases. So these are very, very important. Know their definition and know example and types of this because it is important for 5 marks and 3 marks. Then in point B, so learn all the diseases. Don't skip even a single disease. Learn the Jwara Chikitsa Sutra, learn the Avasthanusara of the Jwara Chikitsa and all the modern disease. Make sure you are learning some points of Ayurveda treatment to it and prepare all of those diseases for 5 marks. In point number 2, all of the diseases, especially Amavata, Pandu, very, very important because high probability of asking a long essay question, and all the other disorders be prepared for 5 marks and 3 marks. Again, Chikitsa, point number 3, Raktavaha Srotas, in that Rakta Pitta, Kamala, Kumbha Kamala, Halimaka are very, very important, and rest of the diseases are important for 3 marks and 5 marks. And point number 4, health programs for 5 marks and 3 marks. They can ask the disease and the symptoms ask you to list the national health programs, or they can help you, they can ask one national health program, or it can be malaria, or it can be AIDS for 5 marks. Then point number 5, as I told you, any one system of medicine definitely will come. That is for 5-mark question. Point number 6, probability of asking a question for 3 marks, and the model management, the Ayurvedic management for 5 marks. Point number 7, so all the questions probability of 3 marks. And point number 8 for 5 marks, all the emergency management. Hope we have covered the paper 1 priority wise topics. So now you know which are the priority for long essay question, what is a priority for short essay question, and for short answers. So don't forget to revise the types, don't forget to revise the definition, don't forget to revise the normal values and ECG findings. All of these are very, very important. Okay. So that is all for paper 1 part A. I hope we have covered most of the topics. When it comes to the exam orientation, I hope you know now how to revise well for Kaya Chikitsa paper 1, how to prepare well for paper 1, and how to write better answers when it comes to paper 1. I wish all of you all the best. Read, revise, relax, and again read, revise, relax. Okay, there is nothing to worry or panic. You have studied for 1.5 years, and you will definitely get fruit of it. So don't just succumb to that pressure of exams. Read well to practice well, read well to understand it well and apply it to the patients, because ultimate aim is the health of the patient, not our marks. But that doesn't mean that you need not excel in exams. You can do both. I wish you all the very best. Thank you. If there are any questions, I can take it. Any questions?
No question. We extend our sincere appreciation to our esteemed speaker, Dr. Harshita KS, for her valuable time and expertise. Your lectures focusing on important topics, questions that may repeatedly asked in university exams, and how to present the answers for 10 mark, 5 mark, 3 mark for both Ayurveda and modern concepts, and also exam strategies. These information have been incredibly beneficial to our students. We are confident that the knowledge and insight shared will significantly aid them in their upcoming exams. Thank you, ma'am, for such valuable knowledge that you had shared with us today. Thank you so much, ma'am. I thank to all Jignasa team for conducting such valuable and useful session. Thank you everyone for patiently listening and attending this session and make this session successful. Thank you all.
Thank you, Team Jignasa, for giving me the opportunity, and I wish all the students all the very best. You can contact me later also if you have any doubts, but all the very best. Do well.